Hello everyone and welcome back to my channel. Today we are covering the 10 most prescribed drugs in America and key things you need to know about each of them. My name is Navene and I'm a pharmacist, specifically specialized in the arena of primary care. I've worked with numerous primary care doctors and endocrinologists, cardiologists, pulmonologists, pain specialists, and more to help treat and manage over hundreds of patients with chronic disease states like diabetes, cholesterol, blood pressure, and more. As a disclaimer, please do not use anything you hear on the internet as personalized medical advice. If you have questions on anything, reach out to your medical doctor who is the most familiar with your case to make decisions about your medical care. Please do not stop any medications until you speak with your doctor first. Any alternatives you hear may require a pre-authorization from your doctor to your insurance company, which they can do and requires simple paperwork. With that being said, I'm really excited to share what I have learned over the years using these drugs in my practice. Let's get into it. The number 10 most prescribed drug in America is Gabapentin. It's used to treat nerve pain and seizures, and if you're on it, you've probably experienced a lot of drowsiness and have probably had to increase the doses to up to 3,600 milligrams per day. My personal opinion, I don't like gabapentin. Most of my patients would complain of too much drowsiness. Because of this terrible side effect, you are not allowed to operate any heavy machinery, aka drive, and it just really inhibits you from doing a lot of normal activities because you're just so tired. If you are taking gabapentin, ask your doctor about a medication called pregabalin. It's a lot more effective than gabapentin at lower doses, and you'll experience far less side effects of drowsiness, helping you do your normal daily activities. My patients prefer it, and I've noticed better results after switching them. It's important to not abruptly stop either of these medications, so speak to your provider before making any changes to your regimen. Number 9, albuterol. Albuterol, also known as Proventil, ProAir, and Ventolin, has been used for over 70 years as a rescue inhaler for people with asthma and COPD. This recommendation I'm about to give you is relatively new, with changes made only recently in 2023 that are very important, but a lot of doctors and providers are not aware of it. If you have asthma and you are on albuterol, ProAir, Proventil, or Ventolin, ask your doctor to review the new guidelines and change you to Symbicort for rescue therapy. And why I say this is because new evidence has come out that long-term use of albuterol can cause worsening asthma, increase the risk of heart disease, and death. Because this is new and demonstrates one of the biggest changes in the way we manage asthma, it's super important to speak to your pulmonologist about this medication and switch you over to a medication called Symbicort for rescue or as needed for exacerbations. It demonstrated a higher safety profile as it delivers 2 medications in one that are necessary in relieving symptoms and improving quality of life. I remember working in the clinic, and when this evidence came about, it took a lot of convincing for the doctors to get on board, but now it's part of the guidelines, and a lot of people and a lot of patients, especially who have had asthma for so long and who have been taking albuterol as their, regular inhaler for exacerbations and rescue therapy, or have not had any follow-ups with their doctor, don't know that the guidelines have changed. So if you're on albuterol for asthma, please make an appointment with your doctor. I recommend it so that you can discuss with them possibly changing over to this Symbicort. Next, losartan, number 8. Losartan is a great medication used for blood pressure, and even better if you have any type of kidney disease. You can take this medication any time of the day and you'll be fine. Of course, I recommend you take your medications at the same time every day, whichever part of the day you choose. Losartan is a great alternative to a medication called lisinopril, which we will discuss in a bit as it has a lower side effect profile. If you've been on it for a while, that's great. Make sure you're having your potassium levels checked at least yearly. If you're just starting it, watch out for any swelling in your mouth or tongue. If this occurs, seek medical attention immediately and administer an EpiPen if you have one. Also, have your doctor check your potassium a month after starting it to make sure it hasn't increased, and if it did, make sure you ask him to switch you to medication or lower the dose. Number 7, omeprazole. This one is a highly monitored medication in the medical field. Tons of studies are done on this medication in hospitals because we want to get people off of it. That's right. We do not like this medication because it has a lot of long-term side effects such as decreasing bone density, increasing the risk of bone fractures, lower magnesium levels, lower B12 levels, respiratory infections, severe diarrhea, respiratory infections, and more. Did I say respiratory infections? My colleagues and I have worked very hard to control the use of this medication. Omeprazole is used for acid reflux quite frequently because, yes, it works really well at decreasing stomach acid, but it works too well and it can cause a lot of side effects as mentioned. So my recommendation, use acid relievers as needed only. And what I mean by that is if you have acid reflux, do a treatment dose of 14 days and that's it. Take things like Pepcid or Zantac after that as needed, not all the time for your symptoms. If you are one of those patients, please talk to your doctor to make a plan to get you off of it as soon as you can and just take it as needed. And also, if you are taking it, it's best to take it 30 minutes before you eat if you want to get the most out of the medication and the best result. It has little to no effect if you take it during or after your meal, as your stomach has already released the acid, and omeprazole works by stopping your acid pumps in your stomach before acid is released. Number 6, metoprolol. It's a medication used primarily in heart failure and sometimes blood pressure, though it's not high on the recommended list for blood pressure anymore. So if you do not have heart failure and you're on it, ask your doctor to switch you to something like losartan if you're not already on that. Metoprolol is very good for heart failure. It does cause lightheadedness, so to get the most out of the medication, to decrease the side effects, I really recommend you take it with food. There's a regular formulation that's taken twice a day, and then there is a extended release medication you can take only once a day. So if you're on a lot of medications, which a lot of heart failure patients are on, you can ask your doctor for the once a day medication so you can decrease your pill burden, as we call it, the amount of pills you're taking. Next up is amlodipine. Amlodipine is another blood pressure medication, and the first thing I ask my patients who just started this medication is if they've noticed any ankle swelling. This medication has a high rate of edema or swelling on the legs. If this occurs, I switch my patients to a different medication usually. Other than that, it's pretty well tolerated and you can take it any time of the day, with or without food, as long as you keep it consistent, of course. Next is metformin. Metformin is a widely used medication for diabetes and PCOS, but for this video, we are going to focus on the treatment of diabetes. It's a really great medication and doctors love to prescribe it. You need to know that your kidney function needs to be monitored while you're on it, as it may affect the dose that you're taking, whether your kidney function is lower than normal. If it is, you can't take too much of it. It does cause diarrhea when you first start it, but if you can tolerate it, keep taking it, as it's a great medication for diabetes, and the diarrhea is normal and should go away after a couple of weeks. Start slow with this medication with 1 tablet every day with the largest meal of the day, which is probably dinner, but should be lunch in my opinion if you're diabetic, but that's another story. After 2 weeks, increase to twice a day with your 2 largest meals of the day. Make sure you're drinking lots of water while you're taking this medication. If the diarrhea does not go away after 4 weeks or so, or it's absolutely intolerable, don't give up on metformin just yet. There is an extended release formulation. Ask your doctor for that, or just start with that to begin with if you're prone to GI side effects. Some insurance companies may have an issue with that, but have your doctor tell them that you have side effects with the normal formulation and your insurance will cover it. Best thing about the extended release formulation is that you only have to take it once a day, so it's just way better in my opinion in all realms. Reason why we like metformin is that it's effective at decreasing blood sugar and it can help lose weight, and it does not cause any weight gain like some other diabetic medications do. Also, take a B12 supplement if you're on metformin, as it lowers your B12 levels. Number 3, lisinopril. Here it is. Lisinopril is the number 1 medication for blood pressure. It's great. It has tons of studies behind the benefits of the medication, including its kidney protective benefits in the long term. It's also used in heart failure as well for its benefits. It's just overall a really great and cheap medication. It's been around forever. It does have a common side effect of a dry cough that can pretty much happen anytime. I've seen people develop this even months after starting. The quickest fix is switching over to losartan, the medication we previously mentioned, which is the same class of drugs and works just as well. It's also important to check your potassium levels after the first month of starting it and at least yearly after that. Potassium is one of the most important electrolytes in the body that helps with almost every single function of life form, causing your heart to beat and your muscles to contract and more. So that's why it's really important to monitor it. Next is levothyroxine. This is a commonly used medication to treat low thyroid levels. It's very, very effective at very low amounts. That's why it's dosed at the microgram level and requires checkups sometimes every 6 weeks to get the dose just right for you. Thyroid function is very important on so many levels, so please comply with these frequent checkups. I know it sucks to go in for so many blood draws, but once we get it just right, you won't have to come in so frequently. 3 important things with levothyroxine. Number 1, take it in the morning 1 hour before food. So I recommend keeping it by your bedside with your bottle of water. So you wake up and you take it right away, and by the time you eat, it'll have done its job. Food makes it less effective and you need it to be effective. Number 2, take it in the morning at the same time every day. And 3, separate any iron and calcium supplements by at least 4 hours. So just to be safe, switch those supplements to nighttime dosing and you'll be good. Last but not least, atorvastatin, used for cholesterol. It's a very good medication, very well tolerated. You can take it any time of the day with or without food. Just make sure you're consistent at the same time every day if possible. Watch out for any muscle cramps or aches or pains, dark urine, tea or cola colored, feeling weak or tired or unable to complete tasks or finish a workout you were able to do previously. These are signs of muscle breakdown. It's a rare side effect with atorvastatin, but something you should be aware of. Another thing people like to mention is that grapefruit juice can increase the effects of atorvastatin, therefore increasing the effects of it. So I only mention this if you're a really heavy drinker of grapefruit juice, then I would just be cautious of this. A grapefruit, the actual fruit, once a week is fine. There you have it. That was a lot of information. So if you want this information in a nice, concise, bullet point format, just email me at performancepharmacyrx@gmail.com and I'll send you a document for free and any other information I come out with that may be helpful for you. If you know someone who is taking prescribed medication, they are likely on one of these medications and I am sure could benefit from watching this video. So please share it with them so that they can get some information as well. A lot of this information is unknown to people because unfortunately retail pharmacists are just sometimes way too busy to talk to patients when they pick up their medications. Don't worry, this will change in the future with the emergence of AI. Be sure to subscribe to my channel for more awesome videos like this one. Now go out there and just win at life and health and everything. I got your back. So comment if there's anything else you want to know about your medications. I'm here for you.